The Neo-Tee is a simple life-saving device designed to deliver safe, controlled ventilation to preemies and newborns. For today's demonstration, I'll be using a version with an orange PEEP knob that offers higher positive end expiratory pressure with a lower flow. Keep in mind there are several Neo-Tee configurations available, so always follow your hospital's protocol. This configuration includes a manometer, a red protective cap, a peak inspiratory pressure or PIP controller, and an orange PEEP knob. You will also need a gas source such as a flow meter with a blender, or an oxygen tank. Step 1. Connect your Neo-Tee to your flow meter and set your flow between 5 and 15 liters per minute. Step 2. Set the PIP controller to the 10 o'clock position. Step 3. With the red protective cap on or the infant test lung attached, cover the PEEP hole with your finger to achieve 20 centimeters of water pressure. If the manometer does not reach 20 centimeters of water pressure when the hole is covered, adjust the PIP controller until it does. Step 4. Adjust the orange PEEP knob until the manometer reads 5 centimeters of water pressure. Once the device is set, with a PIP of 20 and a starting PEEP of 5 centimeters of water pressure, remove your red protective cap and attach your mask. You are now ready to resuscitate. NRP guidelines recommend using a blender. Hold the mask with a CE grip, avoiding pressure on soft tissue under the chin. Use the manometer to confirm a proper mask seal. To activate the override to exceed 40 centimeters of water pressure, press down the red button on the PIP controller and increase by turning the knob clockwise to desired pressure. It does not need to be pressed again when turning back to normal range. You will hear an audible click. The Neo-Tee has been trusted worldwide for over 15 years. With many configurations available, application steps may vary. Always follow your hospital's specific protocol when using this device. For more information, visit our website at mercurymed.com.